Good afternoon, everyone. My name is Bernard Rubenstein. I am the Managing Director of Franchise Benefit Solutions. Again, before we get into anything, I want to give a huge thank you to Comfort Care and your At Your Side Home Care and Best Life Brands for inviting us here today. We really appreciate your partnership and the opportunity to support all of you. Quick intro. Again, my name is Bernard Rubenstein, Managing Director of Franchise Benefit Solutions. I've been with Franchise Benefit Solutions for about 45 years. Uh, Along with myself, I have Michael Rubenstein. He's the Operations Manager for Franchise Benefit Solutions. He's been with us for approximate 10 years plus. And we also have Greg Kazabuchi. He is with ASA Evolved. And for those of you that attended the webinar or the meeting at the Comfort Care Care Patrol Conference, Greg wasn't able to join us. However, I mentioned his name quite a bit during the conference. So like Michael said, if you have questions, please hold them to the end. I do want to mention there was one question regarding the subsidies that we talked about in the presentation at the conference that I was incorrect, but you'll, as we get to the end of the presentation, which is similar to the one from the conference, Greg will answer it. So with that in mind, switching to our agenda, we will be discussing what's changing in 2026, what is an ALE, how penalties are triggered. We will be reviewing the MEC and MV solutions, IRS reconciliation, and Franchise Benefit Solutions overview of our benefits program and how we can help you. So with that in mind, I'm going to let Greg Kazabuchi begin the presentation and go through the ACA.
Yeah, no, thank you, Bernard and Michael. It's nice to be with you today. Been dealing with the Affordable Care Act since the inception of the mandate and helping employers deal with all aspects. I can tell you I've seen a lot of issues with certain industries, one of them being the home healthcare industry, just because of the nature of the business. It lends itself to being particularly vulnerable to penalties under the Affordable Care Act, and we'll go through some of those risk triggers today and what causes it. Many of you may wonder, am I an applicable large employer? That means you average 50 full-time and full-time equivalents over the prior tax year. So if you want to know if I'm subject right now in 2025, you would have averaged 50 full-time and full-time equivalents for all of 2024. That would make you subject to the mandate this year. We will also talk about the recently passed budget bill, and I'm sure everyone wants to know what's going on with those premium tax credits. Are they still around? Did they go away? And so I'll address that. Next slide, Bernard. So the Affordable Care Act begins with what's an applicable large employer, right? Does this law apply to me? So the way that test is done, and many of you may have these reports static in your payroll systems, is again, you're looking at a 12-month average of the prior year. So again, if you want to know, is this law going to impact me for the 2026 tax year, right? Heading into January of this year. You would pull that report for all of 2025. And what that report is doing is it's calculating on a month-by-month basis the total hours. And I do note it uses the number 120 here, not 130 for full-time. So if you work 120 hours or more in a month, you are a full-time employee for that month, again, only for applicable large employer testing. Everybody that worked less than 120, you would total all those hours up and you would divide by 120. And that would give you what's called a full-time equivalent number. So you do that again, employee by employee, month by month. You add those full-time equivalent numbers for each month, total them all up, divide by 12 and round down. If that number is 50 or greater, you are an applicable large employer. Now, you have to factor in what's called common ownership. So if you have multiple entities, you need to do what's called an employer aggregation control group to see if those entities all need to be included and you're just one large employer, even though you might have multiple tax IDs. Or can you separate some of those companies apart and they can stand on their own? So that is actually the first step. Next slide, Bernard. Okay. Um, so if you're subject to the mandate, right, there are a couple penalties that people are worried about, right? The first one, think of these similar to like your W-2 and W-3. There's a failure to provide those returns to the employees, just like a W-2, right? You have to furnish those to the end of the year. And there's a failure to file those with the IRS. So you take those W-2s that you given to the employee, right? You put the W-3 on top and you submit that to the IRS. Same thing here, right? You have to give 1095s, but 1095s are only for a full-time employee. Not every employee is going to get a 1095. Full-time employees get a 1095. You're disclosing to the employee, just like a W-2, what you're going to send to the IRS. Then you take those 1095s and you put the 1094 on top of it and you send that to the IRS. Those are due generally by the end of February, right around whatever the first business day in March is to the IRS for the following year. So 2025 forms will be due right around March 1st, 2026. Next slide. So that's the form furnishing and filing. Now, what you are filing is your compliance around the employer mandate, right? If you are over 50 or more employees, the mandate says, hey, you need to offer minimum essential coverage, minimum value, and make that affordable. And remember those things, right? MEC, minimum essential coverage, MV, minimum value, and affordability. Those will come into play as we talk about the benefits with Michael in a little bit. So there are two major penalties. One is what's called the hammer penalty. It's catastrophic penalty A. And that means if you're over 50 subject to this law and you choose not to comply, or you're not going to meet the offers to what's called the 95% accuracy rate, the IRS gives you this 5% margin of error of determining whether that employee is a full-time employee under the ACA law and did you offer them insurance. So if you did not meet that, then you get the hammer penalty, meaning the IRS will fine you on every full-time employee that month if one person goes to the open marketplace and gets premium tax credits or the subsidies that you are referred to. So one person goes to the marketplace, gets a subsidy. The IRS looks at how many full-time people you have that month. They give you 30 free. So the first 30, no penalty. 31st full-time employee and above. Let's say you have 130 full-time employees, you're going to be tagged on 100 employees and you get penalized on every one of those. That is penalty A. Nobody wants that. That's what every business was worried about. So let's say you pass that test, right? You're offering insurance, you're complying with this mandate, you're offering to all your full-time employees. Then the IRS says, okay, what is the quality of that insurance? Does it meet minimum value standards, MV? And did you make it affordable? So insurance premiums, you get a quote, right? You can't just charge the employee whatever amount out of that quote. You have to make it affordable. The IRS defines that as 9.96% going into next year. So you can't charge them more than 9.96% of their W-2, their rate of pay, or the federal poverty line. For your industry, please note you guys should be using what's called the rate of pay safe harbor. You're not going to charge more than 9.96% of the individual's rate of pay. So if it doesn't meet both those, minimum value and affordability, and it's that person getting the premium tax credit or subsidized healthcare on the marketplace, the B penalty, think of that as a belly button penalty. You only get penalized for that belly button, that person only. So unlike the A penalty where they hammer you and fine you on everybody, the B penalty, you only get penalized in that person. So some businesses choose to not make the plans affordable because healthcare is expensive, and they'll take the B penalty risk that if that person is the one getting subsidy, you'll pay a penalty for it. But nobody wants the A penalty. So it is important to understand full-time counts, right? Am I above 30, under 30, what my penalty looks like. Next slide, Bernard. I did jump ahead of myself. Sorry. The A penalty, this is how it is calculated, but you will have it in the slides, right? So again, you have to offer minimum social coverage. You have to do that to at least 95%, or the IRS will hammer you with that A. Again, it's a pass-fail test. So think of this like your P&L, right? This is a monthly test. So for you guys in the organization, you should have monthly visibility as to how many people are full-time that month, which employees became full-time and did I offer, and what is my compliance percentage, right? Just like your P&L, you're managing your labor costs so that at the end of the year you can turn a profit. Well, here you're managing it every month so you can monitor compliance and make sure you don't fall below that 95%, right? Because if you do, you get fined on everybody. Next slide, Bernard. So this is the calculation. So again, the IRS is only on 2023 enforcement. So they're looking back at what you guys did back in 2023. They will eventually get to 2024 here very soon. People are going to file 25. So they're way behind, right? But those are the penalty amounts by year. You can see it. Again, it is annualized in the middle, but it's a monthly penalty. So again, it's for this year, it's $241.66 times however many people above your first 30 full-time. Next slide, Bernard. So I'll turn it over to Michael to just briefly talk about what the solution is for the A penalty.
So the solution for the A penalty, and we'll be getting into this in a few further slides more in depth, is going to be the MEC plan. So these are ones that are having the ability to be offered to all employees at open enrollment. As you can see here, it can either be 100% employee paid, 100% employer paid, or a combination of the both. We'll be going a little bit more in depth on these and the other solutions here in a handful of slides as well.
Yeah. So don't get confused because MEC is not minimum value. So it's only minimum value that has to meet affordability. That's why MEC, you can make it 100% employer or employee paid or a combination of the both, right? So let's say you offer MEC to everybody. You're passing that 95% rate. Then what is the quality, right? B penalty. Did it meet minimum value? Did you not charge the employee more than the law states 9.5% every year it's adjusted. Again, going into next year, 9.96%. You need to use the rate of pay. If you don't do that, that triggers B penalty for that individual. Next slide. And then this is the amount. So you can see the B penalty is quite a bit higher, right? Compared to 241.66 for 2025, it is $362.50. But again, $362.50 only for that individual that didn't receive minimum value and affordable coverage. Unlike that A penalty where that 241 will apply to every full-time employee that month. So big difference there. At the bottom, if you do, for those of you that are more generous with benefits or can't afford it, I do recommend that you use what's called the FPL Safe Harbor. It's the second line in brown. For 2025, it's $113.20. What that means, or going into 2026, it's $129.89. What that means is that you're not going to make the employee pay more than $129.89 for their portion of healthcare. Employee only. You can make the family members pay 100% of the care if you want. You only have to make it affordable to the employee. If you use that, that is the best safe harbor, but it's the most expensive for you, right? Because if you get an insurance quote, let's say it's $500, you can only pass on $129 of that. The second best solution would be the rate of pay. You just calculate that, and we can go over those formulas later if you have questions, but you would use the rate of pay. Rate of pay times 130 hours times 9.96%, whatever that number is, that's the most you can charge that employee if you wanted to meet the affordability for that rate of pay that you plugged in there. Next slide.
So Greg, before we move forward, a few of the questions that came up at the conference applied to penalty A applied to the whole group when it came to not offering the 95%, and penalty B would only be based on the employees that received a subsidy, correct?
That is correct. Yeah, again, think of this process like your P&L, right? You need someone really doing what's called measurements, tracking employees' hours to determine what their status is, right? Because if you're doing that every month and you know the status of every employee, then you know how many of those employees you offered MEC to, and did you do that to a 95% or greater threshold, right? That gets rid of penalty A. Then out of those, that are full-time that month, where they offered minimum value and affordable coverage, and if not, how many people was it unaffordable for? What is my potential B penalty risk if it's that person getting subsidized healthcare? So just think of it every month you want that visibility. So if you guys lack that or don't have processes in place, that should be a red flag for you to quickly figure out how to get some visibility into this mandate. But you are correct. So penalty B solution, Michael, do you want me to just go over this, or do you want to go over?
Go ahead.
Yeah, so we did. I jump ahead a little bit, but it's in the slide for you. So again, you're offering to more than 95%, you're clear of penalty A. Again, for that individual, the IRS wants to know what is the quality, right, of that plan that you're offering, right? Okay, you're offering to everybody something to everybody, but is it minimum value and is it affordable? If it meets both those components, no penalty. So what that means is, let's say I'm your employee, you offered me a minimum value plan, you made it affordable, right? You didn't charge me more than 9.96%, or you used the FPL amount, the 129 that we talked about earlier, and I don't take the plan. And then I go out to the open marketplace and I go get subsidized healthcare, right? That's taxpayer money being given to me to drive my premiums down. You, as an employer, complied with the mandate, you're safe. You won't get a B penalty, right? When you file the 1095 at the end of the year, the IRS is going to see that you offered me a minimum value affordable plan. It's all going to be listed on that 1095. Me as an individual, I should not have gone and got subsidies. So they'll go after me, the IRS, as the individual, for saying, hey, you wrongfully got subsidies. Your employer said you were full-time, you offered insurance, it was minimum value was affordable, you should have taken that. So that's how the minimum value affordability plan B penalty works. If you do that, you are in compliance regardless of what your employee does. If you don't do that and I go get subsidy, IRS will send you the B penalty. And again, the way that's all done is through the returns. I think the next slide will show that. Next slide. Yeah, so reconciliation, right? I try to make this similar to like W-2s to make you understand, right? So there's like about 24 million people in the US, 22 to 24 million that get premium tax credits. Those are the subsidies that the government's talking about, right? That the Democrats and Republicans were arguing in the budget bill, the subsidies. About 22 to 24 million people get those. Everybody that gets those gets a tax form sent to the IRS, and it reports their social security number. It's that 1095A form right there. And it reports the dollar amount of that subsidy because that's tax money. It's being given to me to drive down my premium on the marketplace. So if my premium on the marketplace says, hey, it's $600, I'm going to give you a $500 subsidy. I only pay $100 for a $600 plan. Well, the IRS wants to reconcile that. They want to know, hey, how many of these individuals are lying to the government and were actually full-time being offered a minimum value affordable plan by their employer? They'll go after me. They also want to know how many employers are not complying, right? So if you're an employer, you're over 50 employees and you're not offering minimum value and affordable coverage, the IRS views you as you're essentially pushing all your employees onto the taxpayer, right? Because now they're going to go out to the marketplace, get subsidized healthcare, and the taxpayer is going to pay for it. They fine you. That's that B penalty. So again, the way that's reconciled, 1095A, every employee that gets a subsidy from the marketplace gets sent their social security with that A form. You, as an applicable large employer, have to track and tell the IRS who a full-time employee is and what you've done around insurance, cost, enrollment, not enrollment. That's done through that 1095C form, and the IRS just takes those social security numbers and they reconcile and they figure out who to go after. So think of that like W-2s, right? You give the employee a W-2 and you say, hey, employee, I'm going to tell the IRS that you made $40,000 on this W-2. If I'm that employee and I try to file a tax return that says, I didn't make any money, I don't owe the IRS any money, the IRS is going to take that social and say, no, we show $40,000 of income. So same thing with that A and C form, right? You give that C form to the employee, says, hey, employee, here's what I'm going to tell the IRS, right? Month by month, what your status was. And then that full-time status triggers, okay, your requirement to offer insurance. What did you offer? Was it minimum value? Was it affordable? Did you enroll or decline? That's all in that 1095C form. That's why it's so complicated and confusing, all in code. And the IRS takes that to figure out, okay, are you in compliance as an employer? Did the individual lie to the government, go after the individual subsidies, or B penalty, A penalty, depending on your compliance? Again, why you want monthly visibility. You don't just want to file these things at the end of the year. So pitfalls, employers can't accurately have employee counts, meaning you don't have proper measurements set up to determine based on the Affordable Care Act who a full-time employee is. Remember, it uses that number 130, unlike the 120 number we were talking about prior, to see if you're subject to the law. And then you have all these different measurement methods. Am I using a monthly method, look back measurement method? It's quite confusing. Um, do you have visibility into employees that you might have missed an offer of coverage, right? Because that drops you below that 95% A penalty, right? And then just overall garbage in, garbage out into technology systems like payroll, right? You guys know payroll's dirty. You have ACA vendors, they just take all that data, put it together, and you get all this incorrect coding. So, um, for those of you that don't look at this monthly, if you have a vendor in place, don't review the returns. I strongly recommend that you do that. We will do that for you for free. So if you guys want a free evaluation, reach out to Bernard and Michael. We're happy to look at. Again, the IRS is only on 2023 enforcement, so we're happy to look at any of the systems, setups, tax returns you have in place. We'll review it and let you know. Next slide, please.
Before we do that, Greg, I think at the end of the presentation here, we have QR codes, and I think, Greg, there might be one for you, but there's a phone number and email, I think at the end, that you'll be able to reach out to us and Greg for if you're looking for additional information. I do want to bring up also that in the years that Greg and I have been working together, I've only had one group that received an IRS letter. They came to us because of our enrollment platform. On the enrollment platform, it does require the employee to, if they're going to waive, the reason that they're waiving. And it's a good way for our employers to use backup information to help them with the IRS. So in the years that we've worked with Greg, we've only had one that came back to us, and the employer did offer that one employee, so they were not subject to that B penalty. So again, with the years that we've been working, we've only had one that actually the IRS came to the employer, and they in turn contacted us. So
And I do want to address one thing because probably most of you worry about like what's going on with this mandate with the budget. So what the Republicans and Democrats were fighting over was something called enhanced premium tax credits. So in 2021, when Biden came into office, obviously shortly after COVID pandemic, right, that you're all familiar with, um, the government enhanced the premium tax credits. What that means is normally when with this mandate, there was a cliff. If you made over 400% of the federal poverty, if your income was over 400% of the federal poverty level, you would not be eligible for any subsidies. But because of the pandemic, Biden said, okay, you can make over 400%. You just won't pay more than 8.5% of your income for insurance. So depending on your household size and income, whatever, right, insurance marketplace you're in, your costs would not be more than 8.5% because the government would subsidize you. And these enhanced subsidies that went out, and those were set to expire at the end of this year. And that's what the government, the Democrats and Republicans were fighting over, holding up the budget bill, is they wanted to extend those credits. Because without those credits, there are about 4 million people that got insurance because they were over 400% of the federal poverty level. So it would automatically put 4 million people uninsured. And those enhanced subsidies um, gave more subsidy to people that were between 0 and 400% of the federal poverty level. They were enhancing the subsidies that they normally would have gotten, and the enhancements now going away. So estimates say that on average, insurance is going to cost about $1,000 more on the marketplace per family. And again, it's based on the income, right? If you're like over 28,000, that number might be like, $1,500 more a year and so forth as you get close to that 400%. But if you're over 400% of the income, zero credits. So that's what the fight was. They estimated it's costing the government about, I think, 350 billion if they extended that through 2036 tax year. So that did not get extended, as you know, right? That was left out of the budget bill. So that is when you hear about, the government got rid of enhanced premium tax credits, it's just that enhancement. There are still premium tax credits available. And as we went over, premium tax credits are what trigger this penalty, right? Employees from 400% and below will get a premium tax credit, and that will trigger that reconciliation. It's about like $62,000 a year in income. I think almost every one of your employees is under $62,000. That's why it's a big risk for your industry.
Greg, this is the one question that I mentioned at the beginning of the presentation that uh, the attendees asked, well, if it's going away, then there's no penalty fee. This is where
Yeah, so it didn't go away, right? Only the enhanced credits went away. So you will have less people getting credits, but you still have like 22 million people getting credits. So that's the confusion again. The premium tax credits did not go away. If you're under 400% of the federal poverty level, you're still going to get a premium tax credit when you go to the marketplace. It's just the amount of credit is lower for those people. And if you were over 400%, there's no more credit. Whereas before, you had about 4 million people who were getting credits that were over 400%. Now you have that cliff. It's a cutoff, right? Under 400%, you get credits. Over 400%, zero credit.
do you want
I do apologize, Bernard and Michael, but I do have to go right now, and Bernard can explain more. But I think my part is done. I appreciate it.
Okay.
Thank you.
Michael, you want to go ahead and explain the program
Sure.
through us?
Yep, I will touch a little bit on franchise benefit solutions. So, franchise benefit solutions, we work exclusively in the franchise world. So, really, we understand how to build a program that's going to fit the way that you operate. So, our goal is really to make benefits one of the easiest parts of your business. So, we set up a program that's already compliant and ready to go. And our online enrollment platform is going to handle all of the administration. So, you can focus on what's most important running your business. So, not only that, to help stay compliant, our online enrollment system tracks and requires waive reasons to be entered by the employees while enrolling to make sure that you remain compliant. So, we have a one-time period of the year that's called a group special enrollment period. It's a period from November 15th through December 15th. It's little known period that the carriers have in place, and it's really one of the biggest advantages that we offer. So it's to allow you all, the franchise owners, to come on board or really make plan changes with no medical underwriting, no waiting periods, and no minimum participation required. Moderate. So it's a simple, streamlined way to get affordable, compliant benefit program in place. So really, you can start 2026 with confidence. Go into the
Just add a little more on that group special enrollment period. Uh, like Michael said, there's no participation requirements. There's no contribution requirements. There is that 30-day window, and if you miss that window, you cannot enroll in the special enrollment. We do have several of you comfort care groups that may put in a comprehensive medical plan for your admin only and then offer the other benefits to the rest of your team. This is the time to do it. Otherwise, under normal underwriting, if you're looking to put a comprehensive plan in, you would have to have 50% of your eligible employees enroll. Under the group special enrollment period, you do not. So just remember, this is different than what you're seeing on the television with the individual marketplace. This is a group special enrollment period, and it's only for that 30 days. So, okay, Michael.
Okay, so we discussed a little bit at the beginning, a little bit in the middle there, the MEC plans. So our MEC plans, or minimum essential coverage, are both affordable and compliant with ACA Penalty A. They are designed with the franchisees in mind. So people who want to offer meaningful coverage, but needing it to be cost effective. These plans are extremely popular across Best Life brands because they are inexpensive, easy to use, and provide first dollar coverage, meaning employees start getting benefits right away without having to meet a deductible. They cover preventative and wellness services at 100%. And for regular doctor visits, so primary care, urgent care, or even behavioral health, employees only pay a simple copay. All plans are going to come with a national PHCS provider network, in addition to 24/7, 365 telehealth access at no additional cost, which caregivers love because it fits their schedule and their lifestyle, no matter what they have going on or their age. It's a plan that not only checks ACA compliance box for penalty A, but one that the employees actually use and appreciate because it's affordable, straightforward, and practical. Our MV plans, or minimum value that we talked about a little bit earlier, are designed to meet the affordability and coverage requirements under the ACA, protecting employers from both penalty A and penalty B. These plans go beyond preventative care. They provide true major medical style coverage that includes doctor visits, diagnostics, and hospital service. For each level that you see on your screen, they offer increasing protection and benefits as you go up. What you see on your screen here is just a snapshot of the coverages for the plan. They all are going to cover the preventative and primary care at simple copays. Uh, Employees then have access to specialist X-ray labs and advanced imaging, again at a fixed, easy to understand copay. These plans meet the ACA standards and stay affordable when the employer contributes to key premiums below 9.96% of employee income. They also can be offered alongside our MEC plans, so you're able to give employees options from basic preventative coverage to full coverage here with the MV, depending on their needs and the budget. So for franchise owners, this means you can offer competitive benefits that appeal to caregivers who want more comprehensive coverage while still controlling costs and staying compliant. And again, for this one, we don't have a minimum. So you're able to enroll in this program all the way down to one employee. So we discussed all the medical side of things. One of the things we talk about is how flexible our program is. What you see here on the screen is all of the plans that are able to be offered. The employee, as the employer and the employee, are able to build a package to offer to your employees of any of these benefits. You can pick and choose. You can offer everything, completely up to you. And for the employees, the exact same concept is if you're offering as many benefits, employees can pick and choose while they go through the online process to pick and choose what fits their needs. Obviously, we touched on the medical with the MEC plans. From there, what we see a lot of employers like to do is add on other options, such as the hospital indemnity programs. It's going to provide extra cash benefits. So if they're ever in the hospital, it's going to help offset lost wages and other expenses. And then they can also bundle additional protection at a very competitive rates, things like dental, vision, life, accident, and so on. So it's a true build your own benefits model that gives employees choice and control while keeping it simple and affordable for you as the employer. And that's really why it's been so popular with caregivers. Everything you see here on the screen is practical, budget friendly, and gives peace of mind for both everyday needs and unexpected situations. So to touch briefly on our how the enrollment platform works for franchise benefit solutions, we like to say we have a four-step system here. So you'll see the discovery, analysis, communications, and enrollment. Really, the way it goes is pretty streamlined in how we work. So we have a very easy to navigate benefits guide that shows all of the benefits available for you. As a employer, you're able to then speak with our office, navigate through those. We're able to present a quote of those options to you. From there, we have streamlined communication, not only to you as the employer, but your employees to help them through the enrollment platform and the enrollment as a whole. We have a online enrollment platform, so not only Is it trying to be as streamlined as possible for you as the employer? It is for the employee as well. So they are able to log in through their email that they would receive from our office to access it, to go through it, and make any elections they might want to make at that point. Everything's very streamlined, so you're not having to go around chasing any sort of applications, getting them to sign anything. Everything is handled through an online system. They're able to select their waive reasons right inside of there as well to make it a very simplistic solution for all. Discuss a little bit this just now for the online enrollment platform. Really, once that you are if anyone here is or is becoming a client, we like to say the most work that really is going to be done is getting things off and running. So, filling out a employer application, getting the census over to our office, really that's what we say is the most work that is to be done as a new group coming on board with us. So, really from there, a lot of it is self-automated in a way, the communication models, how things are done, reviewing and making any changes as an employer, very all simple and streamlined within the online system.
Okay, next steps. Michael mentioned our four-step enrollment process. If you have questions or if you'd like to see our program, we will be sending out the recording of this presentation. In addition, we'll attach our employer guide with the presentation. If you're looking for a comprehensive type program, then we would need census information from you. If you have questions or would like to talk to us about the program or any of the info on with Greg, for those that attended the conference and Greg wasn't able to be there. As Greg mentioned, Greg's mom passed away while we were at the beginning of the conference, so he wasn't able to make that one. And believe it or not, he had to leave early on today's presentation because his dad probably passed away today. So sorry he has to go through it, but if anyone has any questions on it, I think on the next slide, if you have any questions, you can, there's a QR code there. You can download our benefit guide. It's a Best Life benefit guide. You can reach out to us, click the continue the conversation, the QR code there. Here's also phone numbers and emails to reach us. Both Michael and myself can help you on putting a program together so that you would be compliant. Greg is our guru, our colleague. And like he said, if you'd like to have an analysis of where you're at and if you feel that you might fall under the employer mandate, please reach out to Greg. He won't charge you. And again, reach out to us and we're here to help you. So I want to thank Comfort Care and At Your Side franchisees attending, Tiffany from corporate Comfort Care for getting out our message to everyone. And thank you again. Good afternoon, and we look forward to working with you.